Strokes are a very common condition that affect around 150,000 people a year in the UK. They affect the brain, either when blood vessels burst and leak into the brain, or more commonly when they become blocked with a clot and cause brain cells to die due to lack of food and oxygen.
The reason why we need guidelines are because stroke's an incredibly complex condition. It's a disease which happens to people of all ages. It comes on very suddenly, often without warning, but sometimes preceded by a little minor stroke. It then may well lead people to have long-term disability. Now, throughout the whole pathway, from the time they had their stroke or even beforehand, right through to the point at which they then die with their stroke, maybe many years later, they're going to need expert care of one sort or another.
The guidelines set out key recommendations covering all aspects of stroke care and are aimed at improving the quality of care delivered to everyone who has a stroke.
Perhaps the really key ones that are going to have the biggest impact on the amount of disability and death that people sustain as a result of stroke are that all patients with an acute stroke should be admitted immediately to an acute stroke unit. If we can do that, then we can get people being managed by the experts, and that will reduce the likelihood of them ending up with disability. It also means that we get the option to treat them with thrombolysis, clot-busting treatment, and we know that that can very significantly reduce the amount of long-term disability.
Other recommendations include carrying out immediate brain scans to assess the type of stroke, managing attacks to prevent them happening again, and ensuring patients get the correct drugs quickly. These will be carried out by trained staff to make care more consistent across the board.
The problem with stroke care in the UK at the moment is that it's not consistent. Some hospitals are delivering high quality services right across the pathway, where others there's a delay. They might not be offering thrombolysis, which is the clot busting drug. They might have delays to their TIA assessment process, or they might not even have had a stroke unit. So these guidelines give us a mandate and give us the backing to negotiate with our managers, the PCT, the SHA, to put the services in place that ensures consistency of care and a quality of care right across the patient pathway, especially in that rapid time in the first 24-48 hours when acute care can make a huge difference to stroke.
According to the RCP, the UK Department of Health plans to invest £100 million in restructuring stroke care over the next 2 years, helping to avoid deaths and limit disability caused by this serious disease.